Morning folks, it's Thursday the 5th of March. There's Hubei province, central China. Thought I'd give you a nice little update. It's a beautiful day, sun's shining. The sky's never been so clean since the industry's been shut down for a month or so. Yeah, they're experiencing the lowest pollution rates they've had for years here, which is fantastic for everybody's health. Yeah, so some things positive come out of a negative situation. I'll give you the rates today. The amount of infected folks in China are 80,565 that have been hospitalised so far. It's a rather large amount. However, that was up 143 from yesterday. 52,109 people have recovered, which is fantastic. That's 2,195 people since yesterday that have been released from hospital. Unfortunately, the numbers surpassed 3,000 in the deceased rate. It's 3,015 deceased in this country up to this date. That's 31 up on yesterday, which is dropping slightly every day, which is fantastic news. In my district, in Hubei, there's 67,466 people hospitalised out of those figures. 134 new cases yesterday were reported and put in hospital. Good news coming out of this region is 40,479 people have been released. They got better. That's up 1,920 from yesterday's figures. Unfortunately, we've had 2,902 deceased, which is 31 more than yesterday. So the only deceased has come out of this province, nowhere else in China. So their quarantine methods and lockdown methods have definitely worked, saved the rest of their country, which is really good news. Unfortunately, we're in Hubei and we didn't really have a choice in that. Yeah, I got a few things I'd like to say to the Australian people. One, my biggest worry is this self-isolation crap that the government's going on with. Well, I can't see how that'd work. That's just a cop-out. They don't want to stand up and put in place any measures. Self-isolation is very, very difficult, I'm sure, to put in place on your own. You know you have to have food, you have to have supplies, and all sorts of things. No matter what, you're going to have contact with other people. So, and the 14-day period, well, no one's proven that 14 days is the period for this. There's been people here that have been released from hospital and got better, only to be come down with the virus again a few weeks later. There's also a lot of people that are carrying the virus that have no signs whatsoever and are out in the public, and unbeknown to themselves, they've been spreading it, and there's no way of telling these people. So unfortunately, a 14-day incubation or isolation period is really just something that governments have been going off, but it's not really efficient. The only efficient way is to lock everybody down and let nature take its course over the period of time. The government said they're ahead of the World Health Organization on this matter in Australia. They said they're ahead of it. I really don't believe that for one second. If they were ahead of it, there wouldn't be doctors working in hospitals that have been, come down with this virus. There wouldn't be beauticians working in the Gold Coast, spreading it around to 40 customers a day. Yeah, they definitely aren't ahead of the World Health Organisation on their procedures. Otherwise, they would have been a lot more stringent and a lot quicker off the mark at implementing something. I wouldn't be waiting for the government to tell you to wear masks. I wouldn't be waiting for them to tell you it's okay. I'd be taking the initiative on your own as Australian citizens and step up and all start doing what you can. Wearing masks at work, public transport, wherever you are out in public, I think it's essential. And like I said, waiting for somebody else to tell you to do that is silly. They just want to save money. They don't want to panic on their hands. But it's going to get a lot worse if they don't hurry up and, you know, everyone in Australia start to react and work together and try and curb it. That's my belief. I've seen it happen here. People took the initiative themselves. The small townships around this district and in other districts isolated themselves. They shut their own towns down. They didn't wait for other people to tell them. They stopped them, you know, traffic coming in and out. They basically shut their own towns down, and because there was nothing else they could really do, and they don't have the supplies and the medical facilities to help them. Similar to a lot of our rural communities, they don't you know, have the benefits of the city. So I believe that the public really should start to take matters into their own hands and start being proactive and helping the situation rather than waiting for the government to decide when it's best or not best, because clearly, you know, they've let a lot of infected folks into the country unbeknownst to themselves. You know, no one knows exactly what's going on with this virus and how it spreads. Nobody knows how long it incubates in other people for. The World Health Organization can't confirm it. The Chinese government can't confirm it. They're at the front line of this, and they've got all their experts onto it. So for the Australian government to think they're ahead of people, that's a joke. So yeah, take it seriously, guys. Step up to the mark. You know, tell your bosses at work that you think it's a necessity, and yeah, that's the way it is. You know, our oldies are getting sicker than the young folks apparently, so take that into account as well. You know, they need help. They need all the protection they can get. If everybody, you know, throws in and helps, it'll be fantastic for everybody. Anyway, that's about all I got to say today. I've been out cleaning, doing my rounds, trying to get motivated, keep healthy and happy. Boiled eggs for breakfast, a few oranges. That's about all I can do. Yeah, cheers folks, take it easy.